Hello and welcome to Pediatric Case Review. In this episode, we'll dive into the presentations of febrile seizures among pediatric patients. Let's begin. Case number 1. A 3-year-old boy is brought to the emergency department with a history of sudden onset of convulsions. He has a high fever of 39°C, and there is no history of head trauma or recent illness. The convulsion lasted for 6 minutes and was generalized in nature. There is no history of prior seizures, and the child has been otherwise healthy. Based on this information, which of the following is the most likely diagnosis? A. Meningitis. B. Epilepsy. C. Simple febrile seizure. D. Complex febrile seizure. Correct answer. C. Febrile seizures occur in young children and are associated with fever, but without evidence of intracranial infection or other defined causes. The child's age, 3 years, falls within the typical age range for febrile seizures. The generalized nature of the seizure and its duration of less than 15 minutes align with the characteristics of simple febrile seizures. The absence of prior seizures and the presence of fever further support the diagnosis of a simple febrile seizure. Meningitis is less likely due to the lack of meningeal signs and symptoms and other clinical features. Epilepsy typically involves recurrent non-febrile seizures, which is not consistent with this case. Complex febrile seizure is characterized by focal features, duration over 15 minutes, or recurrence within 24 hours, none of which are present in this scenario. Case number 2. A 2-year-old girl presents with a generalized seizure lasting 8 minutes. She has a temperature of 38.5°C and was recently diagnosed with influenza. Her brother had febrile seizures at a similar age. Considering the epidemiology and risk factors for febrile seizures, which of the following factors is least associated with her condition? A. Age of the child. B. Recent diagnosis of influenza. C. Family history of febrile seizures. D. Gender of the child. Correct answer. D. Febrile seizures commonly occur in children between 6 months and 5 years of age, making the child's age 2 years a significant risk factor. Viral infections, such as influenza, are known to be associated with febrile seizures, making this a relevant risk factor in this case. A family history of febrile seizures increases the likelihood of a child experiencing them, which is applicable in this scenario. While there is a slight male predominance in febrile seizures, the gender of the child is the least influential factor among the options provided, as febrile seizures can occur in both genders. Case number 3. A 4-year-old child experiences a seizure on the first day of a febrile illness characterized by rapid eye blinking and unresponsiveness for approximately 4 minutes. The seizure occurred with a body temperature of 39°C. What does this presentation typically indicate about febrile seizures? A. They are most likely to occur on the first day of illness. B. They are indicative of a serious underlying neurological condition. C. They are usually associated with low-grade fevers. D. They are often preceded by other symptoms of illness. Correct answer. A. Febrile seizures often occur on the first day of a febrile illness, and in some cases, they are the first indication that the child is ill. This aligns with the presented case where the seizure occurred on the first day of fever. Febrile seizures are typically not indicative of a serious underlying neurological condition, which makes them distinct from other types of seizures. Febrile seizures are associated with high fever, usually above 38°C, and not necessarily with low-grade fevers. While febrile seizures can be the first symptom of illness, they are often not preceded by other symptoms, which is evident in this case. Case number 4. An 18-month-old boy is brought to the emergency room after experiencing a 10-minute generalized seizure. He has a high fever of 38.7°C, and there is no history of previous seizures. What feature of this scenario is most characteristic of a simple febrile seizure? A. Duration of the seizure. B. Age of the child. C. High fever. D. Lack of previous seizures. Correct answer. A. Simple febrile seizures are characterized by a duration of less than 15 minutes. The seizure duration of 10 minutes in this scenario is consistent with this definition. While the age of the child, 18 months, falls within the typical age range for febrile seizures, it is not as specific as the duration for distinguishing between simple and complex febrile seizures. High fever is a common feature in both simple and complex febrile seizures, making it a less specific criterion. The absence of previous seizures is more indicative of this being the child's first febrile seizure, but it does not distinguish between simple and complex febrile seizures. Case number 5. A 3-year-old girl experiences a seizure lasting 20 minutes. The seizure had focal features and she had a fever of 39.4 C at the time of the seizure. This was her second seizure within the past 24 hours. Which feature most specifically categorizes her seizure as complex? A. The age of the child. B. Duration of the seizure. C. The presence of fever. D. The focal nature of the seizure. Correct answer. B. Complex febrile seizures are characterized by a duration of more than 15 minutes, which is clearly seen in this case 20 minutes B. While age and fever are common features of febrile seizures in general, they do not specifically distinguish between simple and complex types. The focal nature of the seizure and the fact that this is her second seizure within 24 hours are also indicative of a complex febrile seizure. However, the duration of the seizure is a more defining characteristic in this scenario, particularly since it exceeds the 15-minute threshold. The combination of prolonged duration, focal features, and recurrence within 24 hours aligns well with the definition of complex febrile seizures. Case number 6. A 15-month-old girl presents with a high fever of 39.5 C and a seizure lasting 7 minutes. Post-seizure, she appears lethargic and irritable. On examination, she exhibits neck stiffness and a bulging fontanelle. Based on these findings, which condition should be most strongly considered? A. Simple febrile seizure. B. Complex febrile seizure. C. Bacterial meningitis. D. Viral gastroenteritis. Correct answer. C. While the seizure and high fever initially suggest a febrile seizure, the presence of neck stiffness and a bulging fontanelle raise concern for meningitis, particularly bacterial meningitis. Simple febrile seizure typically does not present with signs of central nervous system infection, such as neck stiffness or a bulging fontanelle. Complex febrile seizure may present with prolonged or focal seizures, but the additional signs of potential meningitis make this less likely. Viral gastroenteritis can present with fever and lethargy, but is unlikely to cause neck stiffness or a bulging fontanelle, which are more indicative of central nervous system involvement. Thank you for joining us. Stay tuned for more pediatric case reviews.